Hello viewers and learners of the Postgraduate Diploma in Environmental Management and Law and the Master of Arts in Environmental and Occupational Health. Welcome to this program. Today we will discuss on biomedical waste management, and for the MAENOH learners, this forms a part of the course of MEV 005. Now all of us have visited hospitals, clinics and healthcare sectors. What comes to your mind? What do you see in these sectors? You find a lot of things like the pills, the drugs, the medicines that are being disposed of. We find needles, all right, and you find also the contaminated bandages or the blood and other gloves and other equipments. Now, do these all contain infectious matter? So, biomedical waste management is all about handling these infectious and non-infectious waste in the healthcare sector properly, and we will see what are the waste and what are the types of the waste that are generated in the healthcare sector, and how do we go about it in protecting the human health, the health of the staff, the public and also the environmental health. So first, let us define what is a biomedical waste. So this is nothing but an infectious or potentially infectious waste which comes from any healthcare activity such as hospitals or clinics, and these contain the used needles or sharps. They can contain contaminated dressing material, the human tissue and the cultures and so on. So all these, they can be contaminated with blood, with pus, with certain microorganisms, with bacteria, with viruses. So this can then become a potentially breeding ground for the host of microorganisms to multiply and to invade the healthy individuals. So that is why segregating, collecting and handling these waste, especially the waste in the infectious sector, that is very important. And the people who are handling this waste, they should also be provided proper personal protective equipments so that they wear them when handling these waste, and then within the stipulated time they have to be disposed of in a scientific manner. Now let us come to the examples of biomedical waste. So this can contain discarded needles, syringes and other sharps. They can have the used bandages, the dressings and the gloves. Then they can contain the blood or the body fluid and other human and animal tissues. They can contain the microbiological cultures and the strain or the stock material, and also those slants that are used in order to culture the microorganisms again. Then the biomedical waste can also contain unused or expired medicines and pharmaceuticals, and they can also contain certain chemicals and the radioactive waste. Now talking about the expired and unused medicines. So sometimes even we at home, we have a habit of stocking certain medicines. This can include the analgesics, the pain relievers, or certain medicines that are used for the stomach ailments or for fever, and certain antibiotics which we know that they may come of use when we are in distress before we run to the doctor for help. Sometimes we don't use these medicines and then we dispose them off in the garbage, in the normal refuse and the garbage in the everyday daily activity. Now this is wrong, because medicines should actually be returned to the recycling center or the place where it is designated for, but it should not be thrown like this in a public place, in the street or along with the domestic garbage. So they need to be disposed of properly in a different way. Why? Because these medicines, even when they are thrown off like this in an unscientific manner, that can also give rise to the multi-resistant drug bacteria or the multi-drug resistant bacteria. And we will see some of the examples that so many of the bacteria nowadays, where certain antibiotics were acting on a specific kind of a disease, but now these have failed to give relief to the patients, to the public, because the bacteria have become resistant to this type of medicine or drug. So new inventions and new medicines are required in order to treat, or new combinations of medicines are required in order to treat them. So one specific reason could be disposing of medicines like this, where the bacteria have got resistant to certain type of antibiotics. Now, how are these medical waste, whatever we discussed, the examples, where and how are they generated? So now in the hospital sector, it could be generated during the diagnosis of the patient, during treatment procedures, during immunization of the humans and the animals, and also in the research sector, in the R&D division. Therefore, this waste, the biomedical waste, it should be segregated, they should be treated and disposed of properly in order to protect the public health and also the environment. Now, let us discuss about the pathogens in the healthcare sector. So, there are several pathogens. As I discussed, they could be bacteria, they could be viruses, they can be parasites. There are a host of these infectious microorganisms that can play havoc in the human beings and also in the animals and in the environment. Let us now list and see what are they. So they include some examples like the multi-drug resistant organisms, like the MRSA, in short it is called, that is the methicillin resistant Staphylococcus aureus. Now this Staphylococcus aureus is found in the pus, it is also found in the infectious wounds which are very difficult to heal unless prompt treatment is given, and also Clostridioides difficile. This is actually a gram-positive bacteria. It is a spore-forming bacteria, and this is known to cause severe diarrhea. And here again, this is also, it may cause certain types of colon cancer. So these are certain organisms which have become multi-drug resistant, and they are showing the problems, or the symptoms are being seen in the humans. There are certain viruses also, like the human immunodeficiency virus causing AIDS, the hepatitis B virus, the hepatitis C virus, and all these pathogens, they can then cause the healthcare associated infectious diseases. They are also called as the HAIs. And they can be transmitted from people through contact. It can also be through the surfaces, through from a person to person, to droplet infection like in tuberculosis, then through the contaminated equipments or through people, and also they can lead to serious health issues. So these are the pathogens that are encountered in the healthcare sector. This was just one or two of them which I have mentioned, but there are so many of the pathogens which can be transmitted from a person to person, and also they are also acquired in the hospitals, which are also known as the nosocomial infections. Now the hospitals, they are breeding places or the breeding ground for the harmful microbes. We find the pathogenic organisms, like we spoke about some of them in the previous slide, and therefore they have to be treated with care. Here all the infectious waste, the non-infectious waste, the hazardous waste, everything, and including the cleaning up, the sterilization, disinfection of the equipments, of the wards, of the patient's beds, everything has to be done responsibly, because a small mistake that can cost $1 million and the lives can be affected. Now in the hospital, there are pathogens. They may be like the tuberculosis bacilli, and those bacteria that could also be circulating in the blood of the patients. So like the hepatitis B virus, and those that are within the blood, that could only be transmitted to another person or the staff through the needle prick injuries. So this can be transmitted to the healthcare worker or the staff through the prick injuries. So like this, there have been incidents in many of the places around globally and also in India, where the healthcare staff have been affected with these needle stick injuries and contagious diseases. Now all the patients in the healthcare sector, either directly or indirectly, they are involved with the patient, with the patient's sampling procedures, either it is with the blood, with the mucus, with the urine or other samples, or also in the diagnostic procedures, whether it is in the X-ray centers or whether it is radioactive, whether it is the ultrasound sector and so on, or it is for giving the chemotherapy and other sessions using certain other techniques. So all these staff, whether directly or indirectly, they are at a risk of acquiring these infections from the patient or also from the contaminated surfaces where the patients lean on or where the patients lie down. So that is how they are indirectly affected with the diseases. Now, doctors and nurses, they are the two people who come directly in contact with the patient. Also the OPD, the ward boys in the OPDs, then the laundry workers who are washing the linen, and the pharmacist, they can also be infected by the infected patients. But still the doctors and the nurses, they are more at risk because they are handling the patient directly. So they are at more risk of acquiring certain infectious diseases. Therefore, the healthcare workers can also get certain infections from the blood and also the body fluids. Needle stick injuries, which we just saw in the 2 slides before, then there can be cuts and splashes. All these are certain occupational accidents and incidents which are exposing the healthcare providers to different blood-borne pathogens. So now you can see that this area or this sector, how important it is, because one thing is when we are ill, when we are sick, then we run to the clinics for treatment because we want immediate relief from the pain and from the problems that we are suffering from. And on the other side, you see that 24 hours into 365 days, the doctors, the nurses and all the hospital staff, they are so courteous and they are giving their life in order to treat the patient and to give us a good and warm life. So therefore, it is also our responsibility, our duty that we also handle these type of the biomedical waste responsibly, and we will see how we manage them a little later in the conversation. Also, the transmission of hepatitis B virus, the hepatitis C virus and the human immunodeficiency virus, this has also been related to injuries and the frequency of the exposure. So there are several of these diseases which can be transmitted from person to person and also to the staff who are working along with the patient. So first we are having an idea of what are the wastes that are generated in the hospitals and these healthcare sectors. Then we are having an idea of the different type of diseases which can be acquired in the hospitals and which can be transmitted to the healthcare workers from the patients and also from the hospitals. And then now we will also see the certain statistics as to where we stand on this. So the WHO in 2002, they reported that 35 million healthcare workers and 2 million experience percutaneous exposure to infectious diseases each year. So this is a huge number where the healthcare workers are being exposed to. You see that it runs to millions where they are exposed to these infectious diseases through the different type of the contact, either direct or indirect exposure, and they are affected from this. So this is a report from the World Health Organization. Therefore, adhering to the standard protocols, the rules, the guidelines, and we need certain awareness also, as like just now we are educating ourselves regarding the biomedical waste, and we need the awareness about post-exposure prophylaxis, which is poor in the developing countries among the healthcare workers. So therefore, sanitation, hygiene, environmental sanitation, environmental hygiene, all this is very important and this plays a very big role in the long run. And let us now see the major sources of the healthcare waste. So we find them coming from the hospitals and other health facilities like the clinics. We also find them from the laboratories and the research centers where research is being conducted in order to understand the efficiency of a drug on a certain microorganism, for example. So there are these research centers. And then here again we also find the mortuary and the autopsy centers in the hospitals, and there where these dead bodies are being preserved for a long time, and so there again that room also needs to be kept very cautiously. Then there are animal research and testing laboratories, and therefore like the white mice and for the AIMS test and certain other tests, the animals are also being used. There are also algae which are being used in certain testing of certain toxic chemicals, testing of certain biological toxicants, and also the exposure content, like how long a person can stand the exposure to a certain chemical, a certain metal, or certain solvents, and then finding out the solutions for the same. Then there are also these R&D laboratories where they conduct on the animals the bone marrow acid test, where the bone marrow of the white mice, for example, there again we can give certain toxic doses of a certain chemical or a drug or a medicine, and then we can see the effects in the bone marrow, and then we can genetically see the chromosomal aberrations that are found. So these are all the testing things that are done in the laboratory. And so therefore these testing laboratories also will have a number of these biomedical waste which have to be handled with care. Then the blood banks and the collection services. So the blood banks also, they are collecting the blood sometimes on a regular basis from different institutes, from the educational institutes, and the blood banks themselves, the centers themselves, they also conduct the camps in the different places where they can use the blood and then separate them into the different components, into the platelets and other material for the use in the hospitals for various other operations, or the transplant and so on, or the organ transplant and so on. Then there are also the nursing homes for the elderly. So the geriatric centers and the elderly patient care centers, they will also contain, like they can contain certain infectious waste, they can contain the diapers that are used for the patients and certain other waste. So all these comprise the biomedical waste, and the major sources of the healthcare waste can comprise of some of these aspects. So there are the health risk and the other potential hazards from the health risk that can include the drug resistant microorganisms which can spread from the health facilities into the environment. So the drug resistant microorganisms are some of them which we now explained, like the MRSA. Then you also find the drug resistant tuberculosis bacilli and certain other drug resistant organisms. So all this can have problems with the patient not responding to the treatment on time, not responding to the contemporary treatment, and then we need to see for the newer alternatives, for novel alternatives in order to treat the disease and save the patient. So there are several health risks which are associated with this. Then there is the health risk of toxic exposure to the pharmaceutical products, in particular the antibiotics and the cytotoxic drugs released into the surrounding environment to substances such as mercury or the dioxins, and also during the handling of the incineration of the healthcare waste. So these are all the health risks which can expose a person, for example, to these cytotoxic drugs or to the chemotherapeutic drugs and so on. There can also be certain environmental substances where the mercury is found or certain other heavy metals are used. Then the incineration of these dioxins and all this is particularly banned and phased out in the biomedical waste management rules. So these have to be taken into consideration. Now there can also be the chemical burns which are resulting as a result of the disinfection and the sterilization of the waste treatment activity. So the health risk, the workers can be exposed to health risks such as the chemical burns. Then there can be air pollution which can result as a result of the release of certain particulate matter and the dioxins and the furans and certain other particulate matter which are released during the medical waste incineration. So other techniques can also be employed for handling the biomedical waste. Then there can also be the thermal injuries. So high temperature and thermal injuries and burns can also be another health risk where the workers can be exposed to. And this is also in conjunction with the open burning and the operation of the medical waste incinerator. Then there can be radiation burns. Then there can be the spread of the antimicrobial resistance through unsafe storage, treatment and disposal of the pharmaceutical waste. So these are some of the health risks that are exposing a worker due to burning and due to incineration of these waste. Now let us again come on to the infectious and the non-infectious waste which are found in the healthcare sector. So the healthcare waste can be a reservoir of pathogenic microorganisms. Now here in this photographs on the right side, you can actually see certain discarded pills and the medicines and the liquid form of the medicines which are used for the treatment and ailment of several diseases. And on the left side, you find the discarded needles which have been used for the patients. So these infectious waste, so that could put the health of the hospital personnel and also even the patients who are normal, they could even put the risk of those patients at risk. So this also is referred to as the nosocomial infections, or those infections and the diseases which are acquired in the hospital sector. So that is why even in the beginning I said that disposal of the drugs, the pills, even if we are not using at home, if we are stocked up these things, they have to be returned to the healthcare professional or to the hospitals where they will handle that waste in a proper way. They will scientifically manage that waste, how that has to be segregated and disposed of, rather than just throwing it into the dustbin, and then that can enter the normal garbage waste, and then that can create a lot of problems in the environment. Now when we come on to certain statistics, nearly 85% of the hospital waste, they are non-infectious waste. The rest comprise the infectious waste. So this infectious waste, that can be contaminated waste with blood and other bodily fluids, and they can contain the cultures, the stock of infectious agents from the lab work. They can have the waste from the patients in isolation wards and also from certain equipment. So all this will comprise under the infectious waste, which is just coming under 15%, and the other 85% is basically non-infectious waste. So the non-infectious waste, that can comprise of the things that are used by a patient, maybe something that they eat or which they use, and so on. Now under the infectious waste, we have the pathological waste and we have the sharps. That is, the pathological waste can consist of the human tissues, the organs or the fluids and the body parts. The sharps, this can contain syringes, the needles, disposable scalpels and also blades, etc. So here in this photograph, you can see how the bandages and the dressings, they are actually contaminated with the blood and the bodily fluids. So they are the pathological waste, and this comprises of all these infectious waste. Now chemicals are also used, as we said earlier. So these chemicals can be certain solvents. So if we need to, every year, all of us do our master health checkups, and some of us do them even quarterly or even 6 monthly. So now what happens over here? The blood is being drawn, or you give the urine to the blood laboratories or to the hospitals, and then there they analyze. Okay, there are a lot of analysis which are being done, and they see, so how are these analyses being done? So there are certain instruments that run the same. There are certain solvents which are added to it because the blood should not coagulate, and then all these are being run for getting the results of the patients, the different parameters which we have given for testing. So these chemicals that are used for the lab preparations, the solvents that are used for the preparations, then they can also include the disinfectant. They can include the heavy metals that are contained in the medical devices and also certain batteries. So these chemicals, all these colored liquids that we are seeing, that also needs to be disposed of scientifically. So even that cannot be just like, for example, EDTA. So this EDTA or the ethidium bromide, all this you cannot just dispose it as such into the sink. And even while handling it, you need to have the proper protective equipments, and we need to have the fume hoods where we are conducting the experiments properly. So these are certain ways and the certain waste which are generated in these healthcare sectors and how we go about in handling them in the proper way. Then we find the pharmaceuticals like the expired and unused drugs, the vaccines also, like during the COVID-19 we have seen how much of the vaccines also was stored in the different facilities, and then these vaccines also had to be disposed because the date would have gone or the efficiency would have then been less for such vaccines. Then there is radioactive waste, which are the products which are contaminated by radionuclides, the radioactive diagnostic materials and the radiotherapeutic materials. So these are another two types of the waste which are found. Then coming on to the general waste or the non-hazardous waste which are also found in these sectors. So here that is, these wastes do not pose any hazard like the infectious waste. In particular, they don't cause any hazard, but again we find the biological, chemical, the radioactive and the physical hazards that can be caused due to these waste. So now I think we will break for a few minutes and then we will continue with this interesting topic. Hello viewers, this MA program in Environmental and Occupational Health focuses on the relationship between people and their environment and fosters safe and healthy communities, and this is of utmost importance. This program is an MA in Environmental and Occupational Health. The type of the program is a master's program and the medium of instruction will be in English. The duration of the program will be a minimum of 2 years and a maximum of 4 years. The target group will be a graduation from any discipline. Mainly the professionals working in environmental and occupational sector and non-governmental organizations are welcome to join. Doctors, nurses, paramedical graduates and employees can join the course. Employees from the Central Pollution Control Board, civil servants of the state and central governments, faculty, researchers and students in universities, research organizations and colleges will find this program very interesting. Graduates aspiring to pursue a career in environmental management, occupational health and safety, industrial health and safety will also find this program of useful relevance. The job opportunities for this program is tremendous. They can work as environmental health and safety specialist, occupational health and safety specialist in various organizations, HSE coordinator and protection officers. They can also work as worksite wellness coordinators, public administration and safety professionals. They can also work as industrial hygienists and ergonomists in the various organizations. Then the safety and environmental health managers, toxicologists, health and safety engineering specializations are also very important. The objectives of this program include the following. They will discuss the impact of the environmental hazards on human health. Then they will describe the policies, laws, standards and the measurement techniques and applications in different occupational setups. They will also help to develop mitigation strategies to contain and manage environmental and occupational hazards for positive health. Finally, they will also help to exhibit the knowledge and skills that are needed to improve the environmental sustainability of human health systems. First year courses of the MA program include Introduction to Environmental Health, Environmental and Occupational Hazards, Environmental Law and Management, Environmental Toxicology, Occupational Health and Safety Project Work, Environmental Impact Assessment for Environmental Health, healthcare, agriculture and allied sector, industrial sector. The second year MA courses include gender issues in work, employment and productivity, disaster management, sustainable natural resource management, safety philosophy and principles of accident prevention, disaster medicine and global climate change, fundamentals of mental health, gender issues in agriculture, rural livelihoods and natural resource management, globalization, environment and development, and introduction to geoinformatics. The instructional system that is followed at IGNOU includes the multimedia approach, the self-learning materials, audio-video programs, assignments, counseling sessions, project work, teleconferencing and interactive radio counseling are conducted time to time every month for the benefit of the learners. The self-instructional material is available on the eGyankosh website and also the printed material. The assignments are also freely available and they can be downloaded from the IGNOU website on the Students Zone. After successful completion of the first year, the learners can get a postgraduate diploma with an exit option, and the term and examination is held twice a year in June as well as in December. The admission link for the program is ignouadmission.samarth.edu.in. For all queries and support, the program coordinators Professor B. Rupini, Dr. Sushmitha Baskar and Professor Ruchika Cuba from the School of Interdisciplinary and Trans-Disciplinary Studies and School of Health Sciences. I hope you find this course very informative and we invite you to join for this course. Thank you. Hello viewers and learners, welcome back to this session on biomedical waste management. So in the earlier session, we discussed about the types of the biomedical waste and the problems that are being caused due to the infectious waste in the healthcare sectors and how directly or indirectly the staff, the hospital workers are affected with the same. Coming on to rubber and the latex. So rubber latex can be either natural or they can be synthetic, and the natural rubber latex comes from the sap of the rubber tree, and this is found in Africa, in Southeast Asia and in our country too, and this latex is used for making the gloves. So it's a common component of many of the medical and the dental supplies, and here we are using them in the disposable gloves, in the dental procedures, in certain airway and intravenous tubing, then in syringes, in stethoscopes, in catheters, in dressings and also in the bandages. So that way latex is being used in several applications of the medical and diagnostic things. So now, having known about what all waste, so even these latex and the rubber waste can also end up in the landfills. So now we come on to the biomedical waste management. So this is something which involves the proper collection, then their segregation, then the treatment and the disposal of these infectious, non-infectious, healthcare generated waste to prevent the spread of disease and also to protect our environment. So how we are going to manage this in a proper way consciously. So there are some key steps which include using certain color-coded bins for the different waste types. So you can use them for the pharmaceutical waste, for the pathological waste, for the sharps, and then we can employ puncture-proof containers for the sharps. Then we can ensure the treatment methods like the incineration or the chemical disinfection. All this can effectively neutralize the infectious agents. Then we also need to go about the regulations and the protocols. So stringent regulations and protocols, they are mandatory. Like in India, we have the Biomedical Waste Management Rules of 2016, which guide the process in order to minimize the health hazards for the healthcare workers and the general public. Now let us come on to the key elements in improving the healthcare waste management. So here we are basically striving to promote the practices that reduce the volume of the waste that is generated, and we ensure a proper waste segregation. We need to develop certain strategies and systems and improve all these segregation mechanisms and the disposal practices, along with the ultimate aim of meeting the national as well as the international standards for the safe and the environmentally sound treatment of the hazardous healthcare waste. Then the other techniques include autoclaving, because with high pressure and steam and temperatures, then by autoclaving, by microwaving, by the steam treatment, which is integrated with internal mixing and chemical treatment. This can take out a lot of the infectious waste. Then we need to build a comprehensive system which is addressing the responsibilities of the specific people employed, then the resource allocation, the handling and the disposal techniques. So all this is a long-term process, and again we need certain gradual improvements in the long run, but this has to be done in the long run. Then we are also having the awareness programs and raising awareness to all these infectious diseases and the risk that are related to the healthcare waste and of the safe practice of disposing these waste. We need to select the safe and environmentally friendly management options. And we need to protect the people from hazards while collecting, that is, the waste handlers also have to be protected while they handle these waste and while they are storing or even transporting them, like within 48 hours they are transporting it from one sector to the waste disposal site. So their health also need to be taken care of. And then finally disposing of them off. We just don't just burn it in the open so that the air gets polluted and then the particles float around. So there are certain proper practices which needs to be employed in order to transport and to collect and also dispose these waste. Now, government commitment and the Central Pollution Control Board, so their support is always there for the long-term universal improvement, although the immediate action can always be taken locally. And then we also have these action projects and the immediate projects where if there is any immediate goal or of concern which has to be addressed to, then these can minimize the risk of these infectious diseases entering the environment. So why is all this important? Why is biomedical waste management important? The first thing is infection control. So we need to reduce the spread of disease and the hospital acquired infection for the patient, for the general environment, the healthcare worker and also for the public. The next is environmental protection. So that is preventing the release of these hazardous materials, the infectious materials into the environment. So that is why it is important. Again, occupational safety is important while handling certain things. Then again, from the patient to the healthcare worker, an infectious agent can be transmitted. And legal compliance is important, where we need to ensure the facilities are adhering to the national and the local regulations in order to adhere to the biomedical waste handling and also their disposal. Coming on to the key steps in the biomedical waste management process. So the first is the waste generation, which we are addressing, and this is the initial point where the waste is produced in the sector. And then from that the waste is collected and then this is segregated. So this is segregated into different categories like the pathological waste, the sharps, the infectious waste, the needles and the syringes. They can be placed in puncture-proof containers, and that is immediately after the use they can be put into these containers. Then color-coded bags and the biohazard symbols, they are required in order to identify the different waste types. So segregation refers to the basic separation of the different categories of the waste, and thereby you can reduce the risk as well as for the handling and also for the disposal. So this is the most crucial step in any of the waste management practices, and effective segregation alone that can give you the high results. So just like we are having a lot of toys in a child's cabin, and how the child learns to segregate the things, like something which is used as a crayons for the drawing equipment, something which is used for the building the equipment like the Lego builders, or something which is used for the other like the cards, or what they play for the joker, or something like the business cards and so on. So the same way the child learns to segregate his things from the toys, the same way we need to segregate these biomedical waste, which will be a very effective means. Proper labeling of the bins is required, so they should carry the biohazard symbol which you are seeing in this figure, and that is indicating the nature of the waste to the patient and also to the public. So that is why sometimes when you travel on the road, you can find the buses or certain containers which are transporting these radioactive, hazardous and the biohazard waste. They are handled with certain type of the symbols on all over these vehicles. So labeling them and also putting the symbols on these vehicles on the containers is important. Then the color coding is the next step after the segregation. So when you are segregating, there are these 4 codes for the biomedical waste. The yellow bag will contain human and the animal anatomical waste or the soiled waste. The red bag will contain the contaminated recyclable waste like the tubing and the catheters. The white containers, they will contain the sharps including the needles and the scalpels. The blue containers, they will contain the glassware and the metallic implants. So therefore color coding, so that itself will know that this container has this type of the waste. So segregation followed by color coding is also an effective means for proper waste disposal. Then the personal protective equipments should be mandatory for all the personals and the hospital staff. So there are gloves, that heavy duty rubber gloves, they are used by the waste retrievers, and they can be the colors that are given in their protocol. And after handling the waste, the gloves should be washed, and they should be washed with a soap, for example like the Lifebuoy, which contains carbolic acid, and a disinfectant. The size should also fit the operator. Alright. Then there are also certain aprons and gowns and suits or other apparels which are used by the healthcare workers. So this apparel is worn in order to protect the contamination or the contaminated from that contaminated healthcare waste, and the clothing is used so that it will protect the skin of the person. Now this can be made of impermeable materials such as plastic or cloth or tri-ply material, and the people working in incinerator chambers, and they should have this gown or the suit which is non-inflammable material, so that should not catch fire. So these are important. Then mask. So in corona, we have seen that everybody who had this COVID-19 or the virus and even infectious diseases, the doctors tell us to wear a mask to protect ourselves and to protect others around us. So there are various types of mask, goggles and face shield. These are worn in combination. They can also be worn alone, and they provide a barrier so that from us to the other person, it is a barrier. It protects the infectious disease from traveling outside. So this is mandatory for the personnel or the people who are working in the incinerator chamber and who work in the infectious chambers, and also who are handling these waste, and that they can also contain a gas mask with filters. This is also there for those who are working with certain radioactive waste and so on. Then the boots. So the leg covering, the boots and the shoe covers, they also provide a greater protection to the skin where large quantities of this infected waste have to be handled, and the boots should have the rubber sole. They should be the anti-skid type so that the personnel does not skid on the floors, and they should also cover the leg up to the ankle. So these boots are also important. Then coming on to the key steps in the process, the next step is the accumulation and the storage. So once the waste have been segregated using the proper personal equipment for the handler, then it is accumulated and stored in designated marked areas for a limited time, for example 48 hours. After that, it is taken to the disposal facility for the treatment. Before the treatment or the transport, so here it will be accumulated and it is stored for a fixed period of time. After that, the waste is then treated to a treatment site. It is taken there. That could be used using certain wheelbarrows or the closed wheelbarrows which are covered using trolleys and also covered containers, and there they will prevent the spillage and exposure. So it is very important that manual loading can actually, we can avoid that whenever it is possible. The next is the treatment of the waste. So there are several ways how this waste can be treated. So for example, the waste can be treated for the pathogens like incineration, where the waste can be burned at higher temperatures and that could be reduced to ash. Then there is chemical disinfection, where certain chemicals can be used in order to sterilize the waste, and that is done at the midpoint of at the point of the generation for some items. So some of the things need to be chemically disinfected and sterilized. Then autoclaving. So the autoclaves are used where high pressure temperature works over here. So in the steam is generated and the sterilized, like for example it could be gauze and other things which are even used for a patient for the treatment, that also could be sterilized. Then after all these certain treatment techniques, the waste has to be disposed. So after treatment, the waste is disposed. For example, non-hazardous waste that can go to the landfills, there where they can be disposed of. The other treated waste, that is infectious waste which has been treated properly, that has specific disposal requirement. For example, deep burial. So there are certain sites, industrial sites, where these waste are going for the deep burial sites. For example, the anatomical waste. So these are the disposal facilities. And if the waste are not disposed properly, then improper disposal that can lead to the spread of infectious diseases, injuries from sharp, environmental degradation and contamination, and drug-resistant pathogens. Finally, coming on to the rules and the regulation. So we have our country's Biomedical Waste Management Rules of 2016, which was also amended in 2018 and 19, which govern the collection, the segregation, the treatment and the disposal of the biomedical waste. The institutions must maintain the records and they must submit the annual reports to the pollution control boards. Now, if we have a statistics of the biomedical waste generation in India, the total biomedical waste generation in our country is around 484 tons per day. That is from the 1,68,000 healthcare facilities, and out of which 447 tons per day is being treated. So this scientific disposal that includes segregation, collection and treatment, and which has a very minimal adverse impact on the health and on the environment. Now in India, there are 198 treatment facilities, and they are referred to as the common biomedical waste treatment facilities, and 28 are under construction. So 1,31,000 of the healthcare facilities, they are using this common treatment facilities. The quantum of the waste generated in the healthcare sector is also enormous, like 1 to 2 kg per bed per day in a hospital and 600 gram per day per bed in a clinic. And 85%, as we said earlier, is non-hazardous and non-infectious, and 15% comes under the infectious criteria. But mixing up of this hazardous, non-infectious and infectious into the landfills, that is the problematic source. So the new biomedical waste management rules has been modified in order to efficiently manage the generated bio-waste in our country. and we find the salient features of the biomedical waste management of 2016. This has expanded to include the vaccination camp, the blood donation camps, the surgical camp, and other healthcare activities. And basically, we will try to phase out the use of the chlorinated substances and the plastic bags, the gloves, or the blood bags within a stipulated time, pre-treatment of the laboratory waste, the microbiological waste, the blood samples, and the blood banks either through disinfection or sterilization on site as provided in the manner described by the World Health Organization. Then provide training to all the staff. So fortnightly or every month, the training need to be provided to the healthcare professionals on a regular basis. We need to establish a barcode system for the bags and for the containers. Major accidents need to be reported and incidents, and also the dioxin and the furan chambers. This also, the techniques, they within 2 years, stipulated standards need to be achieved. Then the biomedical waste has been classified into 4 categories instead of 10 in order to improve the segregation at source. And then automatic authorization also is being done for the bedded hospitals. The new rules are also having certain more stringent standards in order to reduce the emissions of the pollutants into the environment, like for example inclusion of the emission limits for the dioxins and for the furans. And the state government is providing also the land for setting up of these common biomedical waste treatment facilities. Then the key provision is basically the same, that is for the segregation, for the storage, for the treatment, and for the transportation. Like within 48 hours they need to be transported to the final disposal site. And the barcoding is important, and phasing out certain chemicals and penalties. So the rules specify penalties for violating these rules, and monitoring by the pollution control boards, by the state level monitoring committees. These are mandated to ensure the proper compliance. In 2025, India's 2025 guidelines were coming up for the common biomedical waste treatment facility, and again here they are giving stricter protocols for the safety and for the transportation of these infectious and biomedical waste, and where they are saying that the biohazard symbols need to be displayed on the vehicles, and the GPS tracking is important. That is another added thing in the guideline, and the staff who are handling these waste have to be immunized against certain diseases, and pre-treatment of the liquid chemical waste and before mixing it with other effluents. That is also a stringent protocol which has come for the safer transportation and the safety, and the which are all requiring certain mandatory protocols. So coming on to the conclusion, proper biomedical waste management protects our health, protects our environment. It reduces the infection at source and the infection risk, and again it promotes environmental sustainability. So my dear viewers and learners, today we discussed on the biomedical waste management, and in particular we focused on the biomedical waste management in our country, India, and the waste management rules of 2016 and certain guidelines which have come up in 2025 regarding the common waste treatment facilities. And we have seen the difference between the infectious, the non-infectious waste, and how they can be disposed scientifically, segregated using certain color-coded bar bins, and how the hazard symbols and the coding and the proper disposal facilities using certain treatment techniques can go a long way in protecting our environment, in protecting our own health and also the public health. Thank you for your patient listening.